on the question of why do you and the President think that a public plan is so important in providing quality care at lower competitive prices?
Well, Mr. Chairman, as you are aware, part of my background is shared with colleagues in the Senate, where I was an insurance commissioner for 8 years in Kansas. And so my charge was to regulate the insurance market. And what I'm a believer in, and certainly the President is a believer in, is that competition often is a very healthy component of any market situation. And I think that competition helps promote innovation, it helps promote best practices, and also can help to lower costs. So in the design of a health insurance exchange, which is really what we're talking about, and what the President discusses, a choice of a variety of options is often critical. In many parts of the country, including in my home state of Kansas, there are lots of areas in the state where there aren't choices of private carriers for many citizens. And it's why in our design of the state employee health insurance plan, for instance, we created a side-by-side public and private option so that it helped to promote a network. About 30 states have done similar things. I know in many states in their design of the children's health insurance plan, a public plan is a side-by-side option with private carriers. The underlying issues are, what are the rules? What are the actuarial issues going into the design of a plan, and is there a level playing field? And I can assure you, Mr. Chairman, and some who have voiced opposition, or at least at best skepticism about a public plan option, that the President is committed to, and I'm committed to, the fact that the design needs to level the playing field. And it's on two fronts. First, a public plan option should not undercut the private market, tilt the playing field in one direction. The private market, on the other hand, shouldn't be able to cherry pick the least costly patients. So getting rid of some of the pre-existing medical condition barriers that allow a skewed marketplace, I think, is important. But having an option for individuals, having a choice for the Americans who don't currently have coverage, and having competition to drive the best practices, the best cost efficiencies, the best protocol, I think can be very positive in the long run.